The following is a scenario involving withholding diagnostic information from a young teen with retinitis pigmentosa.
According to the National Institute of Health, retinitis pigmentosa is an inherited disorder that results from harmful changes in any one of more than 50 genes. In the early stages of RP, people experience night blindness and a progressive loss of visual field. In the late stages of RP, as cones die, people tend to lose more of the visual field, developing tunnel vision. They may have difficulty performing tasks like reading, driving, walking without assistance, or recognizing faces and objects. Eventually, most individuals with RP will lose most of their sight. RP is incurable but can be managed via low vision therapy, low vision aids, artificial vision devices, and guide dogs and counseling.
Now that we've briefly discussed the causes, symptoms, and treatments of RP, we'll begin with a simulation of our ethical dilemma, withholding important diagnostic information from patients. Patient Alex, accompanied by her father, just finished an exam with student doctors Marisette and David.
Okay, Alex, to finish up your exam, we're going to need to take a picture of your retina.
Okay, sounds great, Dr. David.
Alex, Dr. David and I will go over what we found with the doctor and get back to you. Hi, Dr. C. We noticed some changes in the fundus photo. Here, take a look.
These changes in the patient's retina definitely look like retinitis pigmentosa. That's what we were thinking too. The patient definitely has some superior visual field loss as well. All right, let's go counsel the patient about the matter. Hi, Alex. Hi, Alex's dad.
Hi, nice to meet you.
Nice to meet you.
So we found some changes in your inferior fundus. You've got some bone spicules, and for this reason, we would like to see you in a follow-up for 6 months. You don't need any glasses today. Any questions?
What are bone spicules? Dad, is there something wrong with my bones?
Doctor, can you explain to us what are bone spikes?
Nothing to worry about. Bone spicules are changes in the retinal pigmentary epithelium that signify accumulation of waste material. For this reason, I want to see you back in 6 months to monitor that everything is all right.
Okay, I guess I'll bring my daughter back in 6 months for a follow-up because nothing's wrong.
That's right. We'll see you then. David and Marisel will be right back with your next appointment.
Hey, David, don't you think that what Dr. C said to the patient was unethical? He did not once tell her that she had retinitis pigmentosa, nor did he tell her what to expect with this condition.
I agree with you, Marisette. We should bring it up to Dr. C.
Dr. C, I have a question. How come you didn't let the patient know about their diagnosis?
Oh, well, we don't need to make the patient suffer needlessly. We will deal with the symptoms as they come.
Well, Dr. C, I believe that was unethical because it is better for the patient to know the extent of her condition so that she could be prepared and let her family know what to expect so they can support her, don't you think?
You have a good point, David, but I've been counseling patients this way for almost 20 years now, and it works just fine.
All right, I understand.
Okay, doctor. Hey, David. Although I respect Dr. C, in the future, I will not withhold any details about patients' diagnosis from my patients.
I agree with you, Marisette. I'll do the same too.
Disclosing diagnostic information varies among doctors due to factors such as culture, religion, and personal preference.
In terms of culture, there's been an overall trend towards full disclosure and patient autonomy in the past decades, but there are still significant differences. For example, a 2005 comparative study on disclosing explicit diagnoses to a pediatric cancer population found that 65% of American physicians disclosed the explicit diagnosis to the patient, while only 9.5% of Japanese physicians did the same. 61.8% of Japanese physicians withheld the explicit diagnoses. It is understood that withholding unpleasant diagnostic findings may be employed to prevent grief and suffering from the patient.
However, we as future doctors of optometry agree with AOA guidelines in that telling the truth is a necessary component of a trusting optometrist-patient relationship.